Our next speaker is going to address a somewhat mysterious topic to both patients and clinicians. Danielle is a part of our melanoma team and works as a genetics counselor, and so she's going to be talking about the genetic aspects of melanoma. Danielle.
Thank you. Good morning, everyone. It's a pleasure to be here this morning. As Dr. Narayan said, my name is Danielle Bonadies, and I'm one of the genetic counselors and part of the genetics team at the melanoma unit. And I'd like to speak to you today about the genetics of melanoma. So what is genetic counseling? As Dr. Narayan said, this is often a mysterious topic that comes up. What do I need to be counseled about in terms of my genetics? Well, we like to think of genetic counseling as an information process. And it's an information process about your risks, your family members' risks, your children, your siblings, your nieces, nephews, your cousins. And the way that we do that is beginning with a very detailed personal and family history. So we dedicate about an hour appointment to that process. And we map out at least a 3, a 4, sometimes a 5-generation pedigree and try to document the cancers that are in that family. So at what ages were they diagnosed? Where did their cancer originally start? And get that whole family tree. From there, we can talk about what hereditary risk factors might be present in that family. And today we'll look at some of the common ones, or the ones that are most applicable to melanoma. And then we can look to see if there might be a hereditary cancer syndrome that could explain the cancers within that family. And if so, we can offer the family testing. We talk about what those results might mean. What would you do with those results? And we try to take a proactive stance on that. So for the most part, we don't do genetic testing just to find out. We do genetic testing to do something with that information, to help someone start screening at an earlier age, or maybe start screening more aggressively than they might have otherwise. And then we can take that information and apply it to the entire family if those individuals are interested. So I'd like to take a look at this pie chart. This is what we think of in general with genetics, that approximately 90% of cancers, this green part, are caused by reasons that we can't really explain right now. Dr. Choi just mentioned some environmental components of for risk factors for melanoma, and those certainly do fall in here, but only 10% are actually genetic or hereditary, and that's the part that our program tries to address. When we first started the program today, Dr. Schnoll talked about, he gave you that big map of the different pathways that they look at in melanoma, and those are all somatic genetic mutations. So those are genetic mutations that occur only in the melanoma cells, and those are very critical and kind of an upcoming area in terms of treatment for melanoma. But our area focuses on germline genetic mutations. Germline means they're inherited in either the egg or the sperm, and then they can get passed on to future generations. Those mutations are also present in every single cell in that individual's body. So let's take a flashback to high school biology. This is a picture of what we would see if we looked underneath a microscope in the middle of a cell. And these long, thin, kind of squiggly structures are all of our chromosomes. And lined along these chromosomes are hundreds of smaller sections of information, and each one of those is a gene. And those genes tend to code for something very specific. So if we took all of these chromosomes and we aligned them from the longest down to the very shortest, you could see that they all get arranged in pairs. So for example, this is pair number 15 here. And within that pair, we have one chromosome 15 that we've inherited from our mothers, and then the other chromosome 15 that we've inherited from our fathers. So really half from each parent. And most of these chromosomes here are numbered all the way down to pair number 22. And that's important because all of the genes that we've so far identified that are related to cancers are all on the numbered chromosomes, and the numbered chromosomes are exactly the same in men and in women. The only pair that differs between the genders is the very last pair here. So this is a female because it has two X chromosomes. If it was a male, it would have an X and a Y. So some people believe for certain cancers that they can only be inherited from mom or only inherited from dad. But this is the biologic reason why we know that we can inherit them from either side of the family, and they can then get passed on to either sons or daughters. So if we took a look at one of these chromosomes and we looked at it a little bit more closely, we said lined along this chromosome there are many, many genes. If you take one section and you magnify it even closer, you'd actually see the chemical combination of that gene. It's kind of like reading through a telephone book. It's thousands and thousands of letters long. And what we've done here is just simplified it down to one pair. So let's say that this was a gene for melanoma. The normal function is for our body to read that gene, produce a protein, and then that protein's job is actually to provide protection against the development of melanoma. And this is the way most genes related to cancers work. We all have them, and they're supposed to work to provide protection. It's only when we find a change in this coding, or what we refer to as a mutation, just a letter change. Maybe this would say AT instead of GC. That we know that when our bodies read that code, maybe it can't read all the way through. So the protein is either absent or it's produced in a way that it doesn't work properly. And so that individual has less protection against the development of that cancer, which means that their chances of developing it are higher than the average person. So the way that we do genetic testing is actually just through a blood test. It's a regular blood draw, nothing special. Sometimes people think that we actually need tissue from a melanoma or tissue from a colon cancer, but that's not true. We can just do it through a simple blood test. And we do read through these genes, just similar like reading through different telephone books. This, I actually think, is the most important takeaway message that I'd like you to have today, are the risk factors for hereditary types of cancer. And this first one is underlined because it applies to hereditary melanoma. So an individual who's had more than one melanoma, it starts to raise our suspicion that maybe they have a hereditary predisposition to develop melanomas. So our threshold is anyone with 2 or more melanomas might want to consider genetic counseling. The second risk factor are multiple affected family members. So these can be close family members, or they could even be further back in the family, aunts, uncles, cousins. But we like to think in genetics as our magic number here is 3. So 3 family members with melanoma. The third risk factor are related cancers in a family, and you've heard me refer to this as hereditary cancer syndromes. And syndromes really just means a collection of features. In this case, most of those features are cancers, so cancers that we know can be caused by the same genetic predisposition. In this case, we're looking for the combination of melanoma and a family history of pancreatic cancer. In other families, sometimes we're looking for the combination of melanoma, breast, and ovarian cancer. So there are these clusters of cancer that we know can be explained by one genetic cause. And I'm going to show you examples of these 3 risk factors, because again, these are the underlying ones and they apply to hereditary melanomas. The next 3 risk factors are risk factors in general for other types of cancer. So early age of onset. This doesn't apply well to hereditary melanoma, but it does for other cancers, such as breast, colon, or uterine cancer. Any of those cancers seen before the age of 50 does raise a red flag for genetics. Unusual presentation. So these are rare cancers, such as breast cancer in a male, or particular types of cancer that don't happen very often. they often make us think about genetics. And then the last risk factor is ethnic background. We know that every genetic disease is a little bit more common in certain ethnic groups. And when we think about hereditary breast cancer, it happens that it's more common in individuals who are of Jewish ancestry. And that does have some overlaps with melanoma. So the first risk factor are multiple primaries. We said anyone diagnosed with 2 or more primaries is a candidate to consider genetic counseling and testing. And this is a family history of a woman who was 59 when we saw her. She was diagnosed with her first melanoma at 23, and you could see that she certainly had multiple melanomas. She had 8 primaries over the course of that span. She had also been diagnosed with breast cancer as well at 48. In her close family, brothers and parents, there weren't any other melanomas, but when we looked further back in the family, she had an uncle who had melanoma as well as a cousin, and then even more distantly through her paternal grandmother, there was a pancreatic cancer and another melanoma. So she certainly was a candidate for genetic counseling and testing, and we did find a genetic cause for her melanomas. The second risk factor are 3 or more family members who've had melanoma or pancreatic cancer. And this is a family history of a woman who I recently saw. She was diagnosed with with 1 melanoma at age 48. Her brother had recently been diagnosed and unfortunately had passed away from a pancreatic cancer. And further back in her family, she had an aunt who had melanoma, a cousin who was diagnosed at 30, and then on both sides of her grandparents' histories, there were 2 other melanomas, here and here. So she certainly had a family history of 3 or more family members, including herself. And she, again, did decide to go ahead with genetic testing, and we also were able to find the hereditary cause for her melanoma and possibly also for her brother's pancreatic cancer. So 3 cancers within related cancers within a family. We've mentioned the association between melanoma and pancreatic cancer. We also know that there's an association between melanoma, breast, ovarian, and pancreatic cancer. And these are 2 different hereditary syndromes. And this is part of the genetic counseling process, that we determine which genetic syndrome might be the best fit for that individual or family, and talk about the risks and benefits of testing and what that information can mean for the family. So this is a gentleman who came to see us who was diagnosed with skin cancer at 54. And he was concerned about his risks for melanoma, to develop another one, as well as for his children, who actually aren't on this pedigree. He had 1 sister who was diagnosed with melanoma at 52. So although there are 2 melanomas in the family, he didn't quite meet the criteria for genetic testing. When we met with him, we expanded this family history more and asked about other cancers. And it turns out that he had several other sisters who had breast cancer, as well as a family history of breast, as well as ovarian cancer. So he was actually a better candidate for that other syndrome that included breast, ovarian, and melanoma. He decided to go ahead with that testing, and we did, again, find a mutation in his DNA. He had 3 children. He had a daughter who was in his 30s, as well as 2 sons that were in their late 20s. And his daughter went ahead and decided to pursue that testing to help learn about how often she should be screened for melanoma. Should she start having breast mammograms? And she learned that she did not carry the mutation in the family. So that was great news for her, that her cancer risks were now significantly reduced. And so you can see that this can impact not only the individual, but as well as their entire family. This is that other hereditary cancer syndrome that I mentioned that includes breast as well as ovarian and melanoma. And these are some of the cancer risks that are associated with it. So in the general population, you can see that melanoma occurs in less than 2% of individuals, but for breast cancer, slightly more common, approximately 12%. And for individuals who are found to carry mutations in these genes, their lifetime risks for breast and ovarian cancer are very significant, as well for other cancers. And so this is an area where genetics can be helpful to guide an individual's medical management. So what can we do if we find out that there is a genetic predisposition in the family? Well, in many cases, it can influence screening behavior. So individuals may be more attentive to their screening appointments. Instead of going once a year, maybe we would recommend going at least 6 months and being followed very closely by their dermatologist. It can also influence their clinician's threshold for biopsies. And as Dr. Choi mentioned, if we can detect melanomas when they're thinner and earlier, it can lead to better prognosis. For pancreatic cancer, we have lifestyle factors that we can help modify, such as tobacco use, body mass index, as well as the limited exposure to smoked or cured meats. There are some surveillance techniques, however, they're somewhat controversial at this point, and we hope that we'll have better options available in the future. And this is an active area of research. For other cancers that I've mentioned, such as breast or ovarian cancer, there are options in terms of being followed very closely at maybe younger ages than would be normally available to that person. We have medications that can help reduce risks for some cancers, and some individuals even decide to go ahead and have prophylactic surgery. You may have heard or maybe even know of some individuals who may have had their breast removed because they were at increased risk for breast cancer. That's certainly not an option for everyone, but some women do choose that. So what about families where it appears that there might be a genetic predisposition, but the people in the family who are the best candidates aren't interested in pursuing that testing, or they don't want to know? We have the option of DNA banking. And so it's just like a savings account where you would put your money and have the bank hold on to it. This is a bank where we can draw your blood, send it to the bank, and they will hold on to it so that in the future, if we get advances in genetics, or maybe that person passes away, their DNA would still be available for future generations to go back and do genetic testing. And the cost of DNA banking is approximately $100 for 20 years, so it's rather reasonable. There are risks and benefits to genetic testing, and this is part of the genetic counseling process. In terms of risks, certainly psychological. Some people just don't want to know. In terms of discrimination, we actually have many or several laws on both the state and the federal level that say that genetics cannot be used as a pre-existing condition, it cannot be used to determine your rates, and it cannot be used to determine insurance eligibility. So we have pretty good protection, particularly against health insurance. At this time, these laws do not apply to life or disability, but hopefully those will come in the future. The biggest risks that we've actually seen are misinterpretation of genetic test results by non-genetics providers. So if you are interested in genetic testing, I urge you to be seen for genetic counseling. The benefits, again, psychological, to have an explanation for some of the cancers in the family can be extremely helpful for some individuals to guide medical management and to provide information to other family members. So this is a list that our program has put together about the greatest urban myths about genetic counseling and testing. So if you'll bear with me, I'd like to go through these. So if you've had genetic testing, your health insurance will discriminate against you. We've just discussed that there are several laws, both state and federal, that protect against this. Your insurance company will not cover the cost of genetic counseling and testing. This is also not true. I would say about 95% of individuals who come to see us have full coverage for not only the counseling, but also the testing. You should only have this testing if you would consider surgery. That's one option, but of course not appropriate for everyone. You've already had cancer, so this testing won't help you. Well, it may give us an idea of what is to come in the future, and it can provide helpful hints in terms of medical management. Your father's family history doesn't count, and I urge you that both sides count equally. You only need genetic counseling if you find out that you carry a genetic mutation. We think that genetic counseling is most helpful done before testing, so an individual can find out all the information before they decide to have that test. And then the last is if you test negative for the genetic mutations that we know of today, you're at population risk. And of course, we don't know everything about genetics, so there are some things that we just don't know about right now. In terms of our program, we have several resources, including genetic counseling by specialists who are all board certified, accurate interpretation of results, as well as a summary letter with a copy of your results that's sent to you and to your provider. We provide phone consults with your entire team, research protocols, database entry, and long-term follow-up through our newsletter and websites. So again, only 10% of melanomas are hereditary, but if you think that this is something that might apply to you, or if you'd like to learn more information, I encourage you to get in touch with our program. And these, again, are just the risk factors that we've talked about today. It's been a pleasure to speak with you today. Thank you very much.